When a new patient is referred here, and this is sort of interesting and unique to our practice as well, 60% of the people that I see come from professionals. And so many people come from other professionals that have told them or assessed them already to be candidates for care. Now, not everybody has the problem that we deal with. And so what we have to do is start by figuring out, do you actually have this problem? Most people, unfortunately, do have this problem. There was a study done in Germany where 30% of children born have this problem, and we think by grade 12 about 2/3 of the population has this issue. The challenge is people don't know about it, and so they come in, they're suffering, and we need to see, do you have this issue? And so what we do is we look at your posture very precisely and see if you can find neutral relative to gravity. You see, the earth is big and we're not all that big, and so if we can stand balanced relative to gravity, we're in a much better spot for our bodies and our muscles to exist. Now, if we're not balanced and that place that we're finding is consistently incorrect, then that's where an upper cervical chiropractor that practices the nuchal procedure like I do can really come into play and help. What we would do is we would take you through an exam to understand what's going on with you once we see that you are a candidate for care. And then we would schedule your longer appointment where you would come back for some very specific x-rays of your head and neck, a complete case history, a physical exam based on that case history, and an adjustment. When you get the adjustment, it kind of feels like you're having your pulse taken. It's a very underwhelming experience. It's like hitting a baseball properly or a golf ball properly. If you've ever played golf, tennis, or baseball, you know the better you hit that ball, the less you feel. And so if we're doing our job properly, you're laying in a neutral, comfortable position on your side, you really don't know that anything's happening to you. And yet then you get to stand up and you'll look and you'll see that you're much more balanced. At that point, if I think you're much more balanced and we're going in the right direction, we'll take some follow-up x-rays, make sure that underneath your skin everything is going according to plan, and then analyze those x-rays and readjust you if necessary. After the adjustment, you'll rest for a little while and let the adjustment settle in because your body has to adapt to what we're doing. It's not just about making the change, it's about making a change that's sustainable for you, that you can keep for the rest of your life with as little intervention as possible. And so we would see you again in a couple of days, and we would see in those first 3 appointments, are we able to really make a difference that is meaningful to you? That's the very beginning of care in our office.